You've probably heard fluids can help cats with kidney disease. But when's the right time to start? How much should you give? Too little may not help, and too much may be really risky. And just as important, how do you know if your cat could benefit from them? These are all the questions I'm going to dive into in this video, so stay tuned. If you're new here, welcome! I'm Dr. Emily, and this channel is dedicated to helping you take the best care of your senior kitty. Make sure to hit that subscribe button so that you don't miss a thing, and like and share the video so I can create more content like it. Let's start with the question, do all cats with CKD need fluids? Actually, let's back up a little bit further. So when I say fluids in this video, I mean subcutaneous fluids. These are fluids that are given under the skin that are either done in the veterinary clinic or by you at home. I'm not talking about IV fluids. Those are given directly into the vein, usually through a venous catheter in a hospital setting. It may seem like a really small difference in terminology, but it's actually a really big difference in treatment plan. So when I say fluids, I mean subcutaneous fluids, not IV fluids. Now, back to the question. Do all cats with CKD need fluids? And the answer is not necessarily. Subcutaneous fluids are usually recommended once the cat can no longer physically drink enough water to account for what's being lost in the urine. So basically, the kidneys cannot keep up with their hydration job. With early CKD, some cats do just fine with dietary changes or increased water intake. Fluids are generally introduced when there's rising blood values, like a rising creatinine or SDMA, when the urine is very dilute, or when your cat is showing signs of dehydration or a decreased appetite. For most cats, this is usually around late stage 2 or early stage 3 iris kidney disease. What are some signs that your cat may benefit from fluids? They may have lower energy or reduced appetite. You may have noticed a distinct increase in their drinking or urination habits. And despite that increase in drinking, they still appear dehydrated. Some cats will hang out at the water bowl. Oftentimes they'll have dry or sticky gums. So basically when you lift their lip up, if you press on their gums, it's sticky instead of slimy. And if you're used to what your cat's skin tint looks like, or that test where we pick up their scruff and let it drop back, if that's decreased or prolonged, that can be an indicator that they're dehydrated. And a cat that perks up after having fluids in the hospital is a strong clue that subcutaneous fluids at home may be of benefit. As a side note, I do want to mention that fluid therapy at home is not always just for end-of-life care. Many caretakers are concerned that once we start fluids, it means it's the end of the journey for their cat, and that's simply not true. In reality, fluids are sometimes started months to years ahead of that stage. My very first cat with chronic kidney disease received fluids for 4 years. So it's important to think of fluids like any other tool in our tool belt. It's a supportive tool like nutrition, medications, supplements. The goal with fluids is not to prolong suffering, but rather to support quality of life. A hydrated cat is simply more comfortable and typically more engaged in their daily life. So how do veterinarians know when's the perfect time to start fluids? Well, there isn't really a perfect time, so to speak, but we kind of build a case or we hedge our bets. So we look at the blood values, we look at the urine results, we look at body weight, we look at hydration status, and sometimes we have to take into account other conditions like heart disease. It also depends on how your cat is doing at home. Are they doing really well? They probably don't need fluids. If their energy level is low, if their appetite is down, and they just look poorly kempt, that may be a time that fluids could be of benefit. The decision, as with many things CKD, should be very individualized to your cat. 2 cats with the same creatinine level may not feel the same, so their treatment strategy shouldn't be the same, and not all cats actually feel better after fluids. One of the most common questions I see floating around on the internet is how many fluids should my cat get? And as much as I wish there was, there really isn't a scientific calculation for how many subQ fluids your cat should be getting. It's going to depend on those lab values, the percent dehydrated your cat is, and what their body will tolerate. It's also possible that the amount will change over time. Sometimes if a cat is dealing with an acute illness or sudden dehydration, we use a lot of fluid therapy. Versus if it's an ongoing daily maintenance and everything else is stable, it may not be that many fluids. So it's important to know why we're doing it and how long we're doing it for before we even ask how many should we be giving. And it's very important to have this conversation with your veterinarian because a physical exam is really the basis for a lot of the decision making when it comes to the amount of fluids we're going to use. Too little fluid isn't helpful, and too much fluid all at the same time, particularly in a cat with heart disease, can cause major issues. Overhydration can cause coughing, breathing changes, swelling, so keep in mind that more isn't always better. And if you do start fluids at home, there are some things that you should be monitoring. You want to watch your cat's energy level, their appetite, and their litter box habits closely. Look for side effects. Are they restless after fluids? Is there any unusual breathing? Is there swelling under the skin that doesn't go away after 12 to 24 hours? It's helpful to know your cat's resting respiratory rate. So how many times do they breathe in a 1-minute time frame while they are sleeping or at rest? If you know that number before you start fluids, and there's any concern in your mind after you start fluids if they are breathing too hard or too fast, you have a baseline number to check it against. If you're not sure what your cat's resting respiratory rate is or how to check it, definitely ask your veterinarian to show you. It's a really important tool to have in that tool belt. It can also be helpful to keep a log of when you give fluids, where you gave them, and how much, as well as your cat's response. These things can help your veterinarian fine-tune the plan. And if you're considering doing fluids at home, some questions that you should ask your veterinarian include, does my cat need fluids right now, or can we wait and monitor? What's the exact volume and frequency for my cat? What signs of too much or too little fluid should I look for? And if my cat resists, is it better to give smaller amounts more often? Or if they're strongly resisting, is this a therapy we should really be pursuing? Fluids can make a huge difference in how some cats with CKD feel, but the safest, most effective plan is an individualized one. Your cat may not be a great candidate for fluids. They may be the perfect candidate for fluids. It really, really varies. And if you're unsure of the answer to these questions, then it's definitely a conversation you should be having with your veterinarian. We certainly don't expect you to figure it out on your own. If you found this video helpful, subscribe for more videos on senior cat care and CKD cat care, and share with another cat caretaker who could benefit from the information. I'd also love to know in the comments, what's your biggest question about fluid therapy at home?